gallbladder carcinoma. So we shall discuss the few important MCQs that have been asked from gallbladder carcinoma and some few potential MCQs. Firstly, risk factors include gallstones, porcelain gall bladder, chronic infection, right? The most common histological type of gallbladder carcinoma is the adenocarcinoma. It is present in almost around 90%, right? So it has a poor prognosis, right? And then such patients usually present very late. They do not have an early presentation. So in your clinical clues, you might be given that the patient presents to you very late, right? So late presentation. Then CA19-9 is elevated in almost around 80% of cases. Then 80 to 90% of cases. The risk factors also polyp of size more than 1 centimeter is a risk factor, which we have discussed in cholecystitis, where we discussed the gallbladder polyp, right? So there need to be minimum 6 lymph nodes need to be removed during surgery, right? And one of the potential MCQs which I feel can come in gallbladder is the T staging of the gallbladder. So let's discuss in short regarding the T staging. So T1 is classified as T1A and 1B. 1A is the tumor which is confined to the lamina propria. Now 1B is the tumor which is confined to the muscular layer. T2 is further into two parts, TA, 2A, 2B. So what is 2A? It is the perimuscular connective tissue on the peritoneal side invasion. So invasion of perimuscular, right? Perimuscular connective tissue on peritoneal side without involvement of the serosa. Now this is invasion of perimuscular connective tissue on hepatic side without extension into liver. So now what is T3? T3 is, just remember what has happened in 2A and 2B, it extends beyond. So over here it breaches the serosa, it extends into liver. Now T4 is what? Over here it would be involving the hepatic artery, the main portal vein, and the extra hepatic structures. Need to remember that in case of T1A, if only lap chole is sufficient treatment. In case of 1B and T2, we usually need to do a radical cholecystectomy, right? So let's revise the most important points again. Gallbladder carcinoma, risk factors: polyp size more than 1 centimeter, adenocarcinoma more than 90%, late presentation, minimum 6 lymph nodes. So T1A treatment would be lap chole, T1B, T2 will be rat chole. So important thing to remember is TA without involvement of serosa on the peritoneal side, and T2B is on the hepatic side without extension into the liver. So that is all for gallbladder carcinoma.